So now, after finishing that introduction, I'm going to get into the area of gastroenterology in older people. And my first case is regarding appetite. And let's see, this 85-year-old woman with hypertension, anemia, and diabetes comes to you with weight loss of 15 pounds over 6 months. Now, that kind of weight loss is significant. It's at least 10% of the weight that she previously had just 1 year ago. And this needs evaluation as to the cause. The patient is on iron, enalapril, metformin, thiazide, and vitamins. She does not enjoy her preferred foods anymore, but adheres to diet recommendations for diabetes. You consider all of the following approaches in addressing the weight loss except one, all of them except one. Inform the patient that it's age-related, review and revise the medication regimen, screen for depression, and consider avoiding dietary restrictions. So, anorexia in older people, it's a complex topic. It's a topic by itself for an hour. And I want to make you understand that it's not something simple. There are a huge number of consequences if you have anorexia, leave alone weight loss, its quality of life, and eventually getting frail and dying. It is not supposed to result purely from aging. There are many other factors, whether they are money, socioeconomic, depression, physiological, pathological, simply having disease processes can cause you to be anorectic, liver disease or kidney disease, or the medications that you give. There are hormones which stimulate appetite, and there are hormones which suppress appetite. Now, there are 5 basic tastes that we all encounter: sweet, salty, bitter, sour, and umami, which is monosodium glutamate. There are controversies as to what you might lose as you get old, but better stated, they have taste preferences. They might tell you, doctor, I need to eat sweets. That's the only thing I enjoy. Or they might tell you, I hate salt. And that might be good actually, because salt is not a requirement as you get old. Please remember this. Salt is something we developed as a result of civilization. In the old caveman's ages, there was no such thing as salt. So we enjoy salt because we like to taste salty foods to some extent. But there are taste preferences. But contrary to that, olfaction is the one that consistently declines with age. And you might wonder, does that matter? Olfaction or smell matters as much as taste, which is less consistently altered with age. So I'm going to give you an example. If I was to go to the store, which I often do, my wife tells me to do the grocery. It's interestingly on Thursdays in the evening. And when I go there, I'm supposed to pick up some fruit. So let's say I have to buy apples. I look at the apples in the store, look at all of them with my eyes, and I see which one appeals to my eyes. And then I take one of them, see how they feel. Are they feeling nice and firm? And do they smell good? When I bring them, I'm actually smelling them, even though I don't recognize the fact that I'm smelling them. When you do want to eat the apple and you put it in your mouth and you crunch, you use your teeth, and then you use your tongue movements to roll it over and then to swallow. And in that process, you're also hearing the crunch. So you can look at how many sensations and features are involved in getting the joy of enjoying the apple. And that just tells you, if I don't want to eat that apple, there are many factors in play. So you're going to wonder, what should we do to any patient who comes to you with anorexia? When people come to me saying they completely lost their appetite and it started 1 or 2 months ago, my God, there's a high likelihood that it's a drug or it's depression. The last time this happened to a patient, I usually love to say stories. I know I'm going to divert, but one of the hospital employees brought in her grandmother with back pain, but that was not her complaint. When I inquired, she had lost her appetite completely. I asked to what food? She said all foods in the last 2 months. And when I dug in a little later, I found that she had been moved into an adult home, into an assisted living facility just 2 to 3 months ago. Now, instead of asking her in front of her granddaughter, is that why you're upset? I asked her a simple question. Do you miss your grandchildren or any other family? Do you miss them? And she cried. Immediately she cried. And that was the answer. I actually was in a very difficult situation of getting between her and the family member who was a hospital employee. I prescribed an antidepressant. And about 2 months later, this employee stopped me in the corridor and said, Dr. D, just wait. And when I waited, I thought I had done something really wrong. I was wondering, I was nervous. And she came to me and said, you gave me my grandma back. And I said, what do you mean? She's great. She's doing so well. So that was depression and complete loss of appetite. So look for a cause, not that we can address all the causes. Look for your medications. Many times this is right there. You have prescribed something like iron, which can cause you to lose your appetite. Look into the mouth, make sure that the dentures, if they are there, are appropriate. If they're missing teeth, that might be the cause. And most important, don't go to the route of giving medications to improve your appetite, because most of them have adverse effects. So onset of anorexia and old age, unless it's from a disease process, such as kidney failure or liver disease, it could be addressed, and it should not just occur. Dry mouth is a common problem from, for example, diuretics. So the answer here is, you do not tell the patient it's age-related, but look for a cause and try to see what you can do. This is very important. As you get older, don't put in a lot of dietary restrictions. Don't eat this, don't eat that, don't eat this. I remember a famous geriatrician who said in a very prominent national meeting, I think it was Dr. Auslander, he's very prominent. He said, if I ever end up in a nursing home and I demand a McDonald's hamburger, please give it to me. Don't put dietary restrictions. I want to be happy. I still remember that statement he made. So remove dietary restrictions. Now, I just threw in this slide. These are the dietary guidelines. These guidelines, US guidelines, are revised every 5 years. They're due for revision right now. If you look at this 10 guidelines that I chose from the whole manual, which is about 200 plus pages, I'll just run through some of them. Nutrient-dense foods, the 10% rule for added sugars, less than 10% of calories from added sugars or saturated fats, 2,300 milligrams of sodium or less. We all eat too much salt, even less for hypertension. Whole grains, fruits rather than juices, oils which are largely monounsaturated. You don't have to go for olive oil. Actually, canola oil is as good or even better. Corn oil, peanut is to your taste. Proteins, as lean meat, you can have a few eggs, not a lot of eggs. Legumes, nuts, and seeds. This is my favorite. This is my snack all day whenever I'm hungry. And fiber. So this is what you need to follow.